The shoulder is an interesting joint that afflicts most of us during our lifetimes, including the person that's speaking to you this morning. There are different conditions that affect the shoulder. Some can be caused by injuries, such as a fall. Those might be fractures, or they could even be injuries to the soft tissues that don't show up on an x-ray. But the things that commonly afflict people that they don't necessarily need to go to their provider for would be a spontaneous onset of pain in the shoulder. What causes those kinds of pains in the shoulder that aren't related to an injury of some type? Commonly, they're inflammation in the bursa, what we know as bursitis, or inflammation in a tendon, such as tendonitis. The long head of the biceps tendon is a common tendon to become inflamed in the shoulder, as is the rotator cuff tendon. The rotator cuff tendon is a tendon that is notorious for gradually degenerating as we get a bit older, and commonly will even have a tear in it, a full thickness tear in it, even not necessarily associated with a specific injury. What can we do about this before heading off to see our provider to get some relief and maybe even avoid having to go to a provider for it? Well, first of all, putting the shoulder to rest is one of the common best things that can be done. Just letting it rest, either using a sling or just letting it hang by your side and not using it for a period of time. That's sometimes difficult to do, especially if you work in a situation where you have to do any lifting. But resting it is an important thing, and if it's a weekend, you want to try to rest it as much as you can. Putting ice on it is commonly helpful for an inflamed joint like the shoulder, so putting an ice bag on it for a period of time, perhaps 10 or 15 minutes, and then even alternating an ice bag with a heating pad can sometimes be helpful. Those are called contrast treatments. Taking an anti-inflammatory medication such as ibuprofen, naproxen, or one of the others that you might already have been prescribed by your provider can also be very helpful for these problems. If the pain persists, however, then you really should see a provider, and that doesn't necessarily need to be an orthopedic surgeon, although we're certainly available to see patients at any time, not necessarily having to be screened by their primary care provider. Your provider will do an examination, take a history, and then perhaps, and commonly will do some imaging studies, whether it be a plain x-ray, and in some cases perhaps even a more advanced imaging study such as an MRI. Those will help us to diagnose whether or not you have degenerative changes in the shoulder. There are two joints in the shoulder, and I have here a model of my shoulder. Here we have the collarbone, the clavicle, the humerus, and the main shoulder joint, which is the ball and socket joint, formed by the humerus and the shoulder blade. We also have the small joint at the end of the collarbone that attaches to the shoulder cap, and that's the AC joint. It's a little secondary joint in the shoulder that does commonly cause pain, and that can get inflamed enough that even ultimately sometimes requires surgery. Chronic bursitis or acute bursitis in the shoulder, this inflammation in the bursa underneath the shoulder cap, can be treated, like I said, with taking an anti-inflammatory medication, resting the shoulder. If it persists, however, coming in and getting a corticosteroid injection is commonly very helpful at relieving the acute pain. It may not be long-lasting, and sometimes surgery can even be required for bursitis in the shoulder, but not usually. The same can be said for the biceps tendon. Commonly it's treated in the doctor's office with a corticosteroid injection, but sometimes surgery is necessary if the pain is not relieved by non-surgical treatment. Thank you very much.